Many elderly individuals believe that after a certain age, sexual activity, especially masturbation, is no longer important. However, according to urologists and men's health experts, this is a misconception that can have serious consequences for prostate health and urinary function. The prostate is a small gland but plays a crucial role in the male reproductive and urinary systems. It produces a large portion of the fluid in semen, which nourishes and transports sperm. Over time, and especially when sexual activity becomes infrequent, the prostate can experience fluid stagnation. This stagnation creates ideal conditions for inflammation, swelling, and a decline in gland function. Discontinuing masturbation for a prolonged period can lead to issues such as frequent nighttime urination, a weak urine stream, a sensation of bladder fullness, or chronic discomfort in the lower abdomen. These aren't merely everyday annoyances, they are warning signs of benign prostatic hyperplasia, BPH, a common condition affecting nearly 50% of men over 60. In contrast, regular ejaculation, whether through sexual intercourse or masturbation, has been proven beneficial for prostate health. This activity helps flush out old fluids, promotes blood circulation, and reduces the risk of congestion and infection. Some studies have shown that men who ejaculate around 21 times a month have a significantly lower risk of developing prostate cancer compared to those with lower sexual activity. In summary, maintaining a healthy masturbation habit not only provides physical relief, but also serves as a simple and natural method for protecting prostate health and urinary function in old age. In middle and older age, many individuals begin to feel that their memory is no longer sharp. Their ability to focus declines, they forget small tasks, or even forget why they entered a room. While some of these changes are considered natural effects of aging, few people realize that the decline in sexual activity, especially the cessation of masturbation, may be an underlying and often overlooked cause. When the body reaches orgasm during self-stimulation, the brain releases a series of beneficial hormones, such as dopamine, serotonin, and oxytocin. These neurotransmitters play a vital role in maintaining memory, cognitive ability, focus, and emotional balance. Without these chemical waves occurring regularly, the brain gradually loses flexibility, sharpness, and its efficiency in processing information. Additionally, a lack of sexual activity is closely associated with a drop in testosterone, a hormone that not only governs libido, but also significantly affects clarity of thought, decisiveness, and life motivation in men. Low testosterone levels lead to reduced focus, slower thinking, and mental fatigue, especially in older men. According to recent studies, long-term sexual inactivity may also increase the risk of cognitive decline and even neurological conditions such as dementia in later years. While it's not the only factor, the lack of natural stimulation from the nervous system and hormones clearly contributes to accelerated brain aging. Reconnecting with the body through healthy masturbation is not just about physical relief. It's also a natural way to nourish the brain, keeping the mind alert and full of vitality, even in advanced age. After the age of 60, many people begin to experience a lingering sadness, a sense of emptiness, and a loss of interest in things that once brought them joy. Sadly, most tend to accept this as a natural part of aging and overlook a critical yet rarely discussed factor: the absence of sexual activity, especially the cessation of masturbation. Sexual activity, even when done alone, has a clear physiological effect on the brain and emotions. During orgasm, the body releases hormones such as oxytocin, dopamine, and endorphins, neurotransmitters that help regulate emotions, reduce anxiety, and bring about feelings of relaxation and satisfaction. When this behavior is removed from daily life, the body gradually becomes deficient in these natural medicines, leading to emotional imbalances over time. As a result, older adults may fall into a state of persistent sadness or boredom without a clear cause. They may feel life has lost its meaning, struggle to find motivation each morning, and lose interest in past hobbies. Some may gradually withdraw, avoid social connections, and become emotionally distant and isolated. Depression in older adults doesn't always appear as crying or obvious sadness. It often disguises itself as prolonged fatigue, irritability, apathy, or insomnia. The troubling part is that many don't even realize they're experiencing depression. They assume they're simply getting old and silently endure. However, in many cases, simply rekindling the connection with their body through healthy masturbation can be enough to lift their mood, awaken their emotions, and restore that vital sense of truly being alive. Masturbation in old age is not something to be ashamed of. It is a simple yet powerful tool to keep emotional vitality from freezing over. It allows older adults to maintain mental well-being and reminds them that they are still alive, still feeling, and still valuable. Sleep is the foundation of overall health, especially for the elderly. However, many people over 60 often struggle with sleep problems, difficulty falling asleep, waking up in the middle of the night, restless sleep, or waking up feeling unrefreshed. While they tend to accept this as a normal sign of aging, few suspect that the root cause might stem from the lack of sexual activity, particularly masturbation. When the body reaches orgasm through masturbation, the brain releases hormones like oxytocin, prolactin, and endorphins, natural chemicals that help reduce stress, relax the body, and induce drowsiness. At the same time, cortisol, the stress hormone that keeps the brain overly alert, drops significantly after ejaculation. This unique hormonal combination helps the body enter an ideal resting state for deep and restorative sleep. In contrast, when sexual activity is absent for a long time, these beneficial biochemical reactions are no longer triggered. As a result, many elderly individuals fall into chronic insomnia, frequently waking up at 1 or 2 a.m. and being unable to fall back asleep. They feel restless, irritable, mentally fatigued, and unable to fully rest. Poor sleep quality not only impacts emotional stability, but also affects memory, weakens the immune system, and increases the risk of heart disease, diabetes, and cognitive decline. Some people gradually become dependent on sleeping pills, which often come with undesirable side effects. Instead of resorting to pharmaceuticals, reestablishing a healthy self-stimulation habit, a safe and natural method, can be a surprisingly effective key to improving sleep. This is not just a physical act, but a natural therapy that can help older adults enjoy restful nights, wake up refreshed, and feel their health rejuvenated. The pelvic floor is a group of muscles located at the base of the pelvis. These muscles play a vital role in supporting the bladder, intestines, and sexual organs, while also maintaining urinary and bowel control. They are also directly linked to mobility, balance, and overall quality of life in older adults. Yet few realize that a simple activity like masturbation can serve as an effective internal workout for these essential muscles. During masturbation, especially at the moment of orgasm, the pelvic floor muscles contract rhythmically. These contractions resemble strength training exercises that help maintain muscle tone and function. Moreover, the activity increases blood flow to the pelvic region, improves tissue elasticity, and enhances neural sensitivity in the area. When older adults completely cease sexual activity, these muscles are no longer regularly engaged. As a result, they can weaken, atrophy, or lose their natural reflexes. This leads to common symptoms such as urinary leakage during coughing or laughing, frequent urination, a constant feeling of bladder fullness even after urinating, or trouble controlling bowel movements. Weak pelvic muscles may also cause lower back pain, hip discomfort, or a loss of balance and stability while standing or walking. Even more concerning, pelvic floor weakness can lead to falls, reduced mobility, and a fear of leaving the house, fueling isolation, low confidence, and reluctance to participate in social activities. In this context, masturbation is not merely a means of sexual release. It is a simple, natural, and cost-free method to preserve pelvic health, promote circulation, and help seniors feel more autonomous, physically stronger, and confident in their daily lives. As the body ages, the natural immune system begins to decline, leaving older adults more vulnerable to common colds, infections, and slower recovery from illnesses. Surprisingly, one small but often overlooked factor that can help strengthen immunity is healthy masturbation. When the body reaches orgasm during masturbation, the brain and endocrine system release a variety of beneficial hormones, including oxytocin, endorphins, and most notably immunoglobulin A, IgA, an antibody that serves as the body's first line of defense against bacteria and viruses that enter through the respiratory and digestive tracts. In addition, these hormones help reduce inflammation, balance stress hormones like cortisol, and improve blood circulation, all of which are essential for maintaining a resilient immune system. Conversely, when self-stimulation is absent for an extended period, these natural immune-boosting mechanisms gradually weaken. The body becomes more susceptible to illness, less responsive to common viruses, and takes longer to recover. Chronic low-grade inflammation, a silent contributor to conditions like heart disease, diabetes, and cancer, also tends to increase when the body lacks these beneficial chemical releases from sexual activity. There have been many cases in which older individuals frequently suffered from recurring colds, fatigue, or flare-ups of chronic illnesses without understanding why. After receiving guidance to reconnect with their bodies through healthy masturbation, many reported noticeable improvements in both their physical and mental health. There's no need for expensive medications or complicated therapies. Sometimes, a simple act like masturbation can provide significant benefits in boosting immunity, helping the body cope better with illness, stress, and the daily effects of aging. One of the most subtle yet profound consequences of stopping masturbation in old age is the loss of a sense of bodily ownership and self-worth. This is not merely a physiological issue, it is a quiet psychological shift, causing older adults to gradually feel disconnected from their own bodies, unable to sense vitality or meaning in their very existence. When you stop touching yourself and stop paying attention to the sensations your body offers, the brain begins to disconnect from the awareness centers responsible for bodily perception. This process can be slow and almost imperceptible. You stop looking at yourself in the mirror, throw on clothes carelessly, stop caring about your appearance, and slowly lose interest in basic self-care, from eating well to staying active. Each day becomes a faded replica of the one before it, and the feeling of "I'm living" is slowly replaced by "I'm merely existing." Many elderly individuals have shared that they no longer feel like a whole person, but rather like a shell, living just to get by, waiting for time to pass. This detachment doesn't stem from serious illness or lack of material needs, but from being severed from their own bodies, unable to feel alive or emotionally moved, even in the most private of moments. In this context, masturbation isn't about indulging in lust. It's a way of reconnecting with oneself, a gentle reminder that this body is still worthy of love, attention, and respect. Maintaining physical connection helps older adults remember that they still have value, that they are still worthy of living and being seen, even if they're no longer young. Re-establishing that connection, even through a small act, can reignite a sense of bodily ownership, restore motivation, and help seniors return to themselves with confidence, dignity, and the deep knowledge that they are still truly alive, not just existing. In society, masturbation is often associated with shame, especially among the elderly. Many people mistakenly believe that after a certain age, sexual activity, particularly self-stimulation, is no longer appropriate, even labeling it as indecent. However, according to experts in men's health and geriatrics, this is a flawed perception that may cause older adults to unintentionally forfeit one of the safest, most natural, and effective methods of maintaining their health. Masturbation is not merely a sexual act. It is a natural form of health care. It requires no medication, no financial cost, and carries no side effects. It serves as a tool for relieving stress, maintaining hormonal balance, enhancing blood circulation, and strengthening the immune system. The biological reactions triggered during orgasm, such as the release of oxytocin, dopamine, and endorphins, play a crucial role in stabilizing mood, improving sleep, enhancing memory, supporting prostate function, and boosting immunity. More importantly, masturbation helps older adults maintain a connection with their bodies, preserving the feeling of being alive, feeling, and deserving of care. At a stage of life where many feel they become invisible, both physically and emotionally, the act of self-love and personal care through intimate touch becomes even more vital. In reality, when elderly individuals completely abandon their private sexual lives, they don't just lose pleasure, they're also more likely to experience a cascade of negative effects: sexual dysfunction, memory decline, depression, insomnia, weakened immunity, and a loss of control over their lives. In contrast, maintaining healthy sexual activity can extend lifespan, improve quality of life, and bring a sense of inner peace. No one is ever too old to reconnect with themselves, and no one should feel ashamed for taking care of their health, even through intimate, personal acts like masturbation. It is not a sign of excessive desire, but an act of self-love that nourishes life from within. So if you are in your later years, be courageous enough to reassess your relationship with your own body. Start with the smallest things, allow yourself to feel, to live fully, and to return to your core truth. You are still a whole human being, worthy of health, happiness, and freedom within your own skin.